Hi, I'm Bess.
Hi, I'm Owen.
And we're both HSRs here at the Broadmeadows Inpatient Unit under the Northern Health Organisation.
So we cover everything on the adult mental health sort of side of things here at the Broadmeadows Hospital. We're kind of in a unique position because we've got some other risks that other areas may not necessarily have as much. Particularly when you look at our patient population, you do find behaviours of concern, so anything from aggression to substance use. So trying to sort of balance the safety and wellbeing of our patient group, or we call them consumers, but also the sort of safety and wellbeing of the staff in the designated working group. That's sort of the challenge for us. One of the original issues that we were having, when we bring consumers into our ward, there are sort of two areas that they can be allocated to. So there's sort of low dependency unit and it's a high dependency unit just based on level of risk. What was lacking at the time was a kind of standardized, streamlined kind of process. What do we actually need to have addressed before the patient rocks up on the ward? We put together a sort of a flowchart that we thought would kind of address those gaps. We had a resultant kind of decrease in incidents of occupational violence and aggression or use of restrictive interventions.
They communicate as a team and they make sure their concerns are escalated and heard appropriately. And if they're not heard appropriately, they are very persistent. They want to make sure that there are long-term actions that are put in place.
A code black is kind of an escalation of an aggression incident. Either somebody is armed with a weapon, the level of threat that they pose exceeds the capacity of your organisation's internal responses. So we were finding that we were calling code blacks with sort of increasing frequency for situations that we actually couldn't handle ourselves. There was a bit of a misunderstanding between ourselves and Victoria Police in terms of what we know we can do and what they think we can do. We actually invited them around onto our ward and physically see what our building is like, see what our consumer population is like, see what our staffing is like. And as soon as they'd actually done that walkthrough, yeah, okay, this is absolutely something that we need to respond to. You can't handle this yourself, you need us. We're not waiting 8 hours, we're waiting about 10 minutes.
I know that I can go to Bess and Owen. They're really approachable and they're really amazing at what they do, and I feel like they will jump straight into it and try and find a solution as soon as possible to ensure our safety comes first.
I think one of the things that's really alarming to me is when people are like, I don't feel safe coming to work. That's one thing that we want to try and tackle. Make sure that you're approachable. The point is for someone's safety. They want to return home to their families. We want to make sure that they feel comfortable coming back. It doesn't cost you anything just to sit down and have a conversation with someone.